Hi, this is the NICU Lived Network, and we are your hosts. I'm Melinda.
I'm Nat.
And I'm Emma. We are all NICU mothers using our lived experience to partner with health professionals to impact research, advocacy, and clinical practice.
Each week we will bring you something new. It could be a topic highlight, the latest in research, a visit to a NICU, or ways in which you can use your lived experience within the NICU to impact change. We hope you enjoy this episode.
Well, hello everyone. You've got Mel and Nat today. Hi. Please excuse my croaky voice. And our very special guest today is Associate Professor Tim Schindler. Hello, how are you?
Hi Mel, how are you?
Good, very good. So the topic that we're talking about today is the WHEAT trial. So WHEAT stands for, and I'll get this right, Withholding Enteral Feeds Around Blood Transfusions. So what we'll do, it is a trial that's currently recruiting in NICUs around the country, and we're going to talk about that. But before we do, we're going to play a really quick 2-minute video, which is actually shown to parents in the NICU. So let's have a look at that. That'll tell us more about the WHEAT trial, and then we can have a chat.
Cool.
Necrotizing enterocolitis, or NEC, is a serious, sometimes fatal condition that affects about 1 in 25 preterm babies born before 32 weeks gestation. We still don't understand this condition completely, but we do know that babies appear to be vulnerable around the time of a blood transfusion. We think that the blood transfusion, possibly in combination with the way that we feed babies, puts extra stress on the gastrointestinal system. Some doctors think that it's best to continue feeds during a blood transfusion, while other doctors think that we should withhold feeds during a blood transfusion. But at this stage, we don't know which of the two is best. The WHEAT trial, which stands for Withholding Enteral Feeds Around Transfusion, aims to answer this question with a really simple design to find this answer quickly and help many preterm babies in the future.
At the moment, with preterm babies, if they need a transfusion, no one knows what the best practice is in terms of whether to withhold feeds or whether to continue feeds. After the lovely staff here explained it to us, we enrolled Ted, our baby boy, in the WHEAT trial. And funny old thing, he needed a blood transfusion about 4 weeks of age.
Ted had his feeds paused over 12 hours during the transfusion. So I was a bit anxious at first about him not having nutrition over that time, but he was fine and he was fine afterwards, so that went well. We look forward to finding out the results and finding out what the best practice is to reduce NEC so that all the babies can benefit in the future.
When a preterm baby has a blood transfusion, it is not known if it is better to pause or continue their milk feeds. In a recent survey, over half the doctors will pause a baby's milk feeds, while the other half will continue them during blood transfusions. Over 90% of parents said that they would like a large trial to find out if either practice will reduce the risk of NEC. The International WHEAT study, which has been approved by the National Human Research Ethics Committee, will answer this question. If you would like more information about the WHEAT study, please speak to your doctor or your research nurse.
So I think that video gives us a really good outline about the trial. But Tim, you are a neonatologist, so you care for babies in intensive care, and you're a really passionate clinical researcher, focused or passionate about trials that are researched around NEC. Why is that important to you?
NEC's something that's always sort of really interested in me, and I think a lot of us that work in the neonatal intensive care environment, we all have stories about babies that have had necrotizing enterocolitis. It's quite a rare condition, but when it does when a baby does get it, it has such a devastating impact on the babies and their families that I just think it's so important to try and get this down as close as possible to zero. My particular example, one of our preliminary studies that led to this wheat trial was supported by the Capaldi family, who support research in our nursery, and their little twin girls, Madison and Charlotte, came through our nursery about 18 years ago, and they were doing quite nicely before one of them unfortunately got NEC and she passed away. And so we still have a twin sister, coming in to see us every now and again, and they're supporting our research. And it's so, it's bittersweet to sort of see her, and sort of, she's a continual reminder that we really have to keep working on this and try and get it as close as possible to zero. So that's the story that I draw on, and I think every person that works in the neonatal intensive care environment has a similar story, and we all know how devastating this is for the babies and the families that are affected by it.
Yeah, and I was just chatting to Tim before we started. I remember when the boys were in NICU and we first found out about NEC, because it wasn't something that we had known about, but it was something that terrified me the whole time that the boys were in the in the NICU. Just really, it sounded really scary. Fortunately, they didn't develop NEC, but and I think thank you to Tim and all your work and this work in the wheat trial, because I think as a parent, anything that can be done to kind of reduce the risk of any baby in NICU developing NEC is a wonderful thing. Like, it really kind of warms my heart to go, yes, this is great. And it'd be lovely when there's a day when there are 0 babies that develop NEC in the end. So
because
thank you.
We were chatting about it before, and I think another thing that you were saying, Nat, was just how it does weigh on you, just thinking that there is this awful condition that some of the babies get, and when you know that your baby has risk factors that predispose them to something like that, thinking, is this going to be my baby, in the coming weeks? So it would be so nice for that not to be a thing. And
hopefully
so
one day.
And so I think anything that we can do to try and reduce that, is a valuable thing to do.
And the wheat trial definitely sounds like it's a big part in kind of contributing to that. And I'm interested, how long has the wheat trial been going for, and which hospitals in Australia are recruiting babies in the trial?
So it's actually been going on for a couple of years now, and it's been affected by COVID, as most trials have been. So it's a very, very large trial, and the reason it has to be so large is because the condition is rare. Or relatively rare, you need a large number of babies to be able to show any potential differences between the things that you're looking at. And so for this particular study, to be able to find a meaningful difference in trying to reduce the rate of NEC, we would need to look at about 4,500 babies. The way that we're trying to achieve that's quite unique. So we've started the trial in Australia, but we'll probably get to it in a little bit later. But there's actually similar trials that are running concurrently in the UK and Canada, so that we can get sort of that number of babies involved in the trial.
So how many? Sorry.
No, you go.
I was going to ask, how many so far in Australia have been recruited?
So we're up to 200 babies that have been recruited in Australia so far. So it's still in its early stages, and a big part of that was us being limited in terms of travelling around to get different sites on board during that COVID period. It was basically just off the cards. So we what we did was we established the trial in one site at our site to start with, and then once things have started to open back up again, we've been starting to get out to other sites to recruit them on board. So we've got 6 sites that are recruiting at the moment, and we're looking at recruiting sites from every state in Australia. And so far we have sites in New South Wales, in Victoria, and South Australia. And as you know, Nat, looks like Darwin's going to come on board as well, which is fantastic.
Yeah, that'd be awesome. Yeah.
and approaching states in Western Australia, Canberra, Queensland, and Tasmania as well. Trying to get as many units as we can involved to optimise the number of babies recruited in Australia, but as I said, combining that with the babies that are recruited in Canada and the UK as well.
Oh, that's great. And so the babies that are involved in the wheat trial, is there a certain selection criteria that you have for those babies?
Yes, so it's all based on the baby's gestation. So we're only looking at extreme preterm babies. But any baby that's born extremely preterm will be approached about potentially being a participant in the trial, but not older babies, more mature babies.
Okay, so what does extreme prem mean? Like anything under like 32 weeks or 30 weeks or 28 weeks?
So the definition of it is babies that are less than 28 weeks gestation. And the wheat trial involves babies that are less than 29 weeks gestation when they're born. Yeah.
Okay, cool. Awesome. And then you mentioned that there are other trials, that the wheat trial is part of a broader international trial. Is that just in those other 2 countries, or are you kind of looking to grow that bigger as well, that international aspect of the trial?
It's possible, but I think more than likely those are our trial and both of those trials have got really significant government funding to be able to do this on a large scale, and so it's really likely that just with those 3 coming together, that we're going to have more than enough babies to be able to get an answer to the question relatively quickly.
Yeah. Oh, that's amazing. So like when you say relatively quickly, do you mean possibly in a couple of years' time that you guys will know the answer to the question, or?
Yeah, I think so. I think probably we will have the numbers that we need in between 3 to 5 years at the rate that things are going at the moment. I know that we talked about, the number of babies recruited so far may seem like a small number, but that's like now that we've got those international studies recruiting as well and more sites coming on board, that number's likely to accelerate quite quickly. It's often quite flat at the beginning. So we expect in 3 to 5 years time that we probably have the numbers to be able to say we've got enough numbers to answer the question, and then go away and analyze it all and present the findings.
There is so much power in collaboration, isn't there? And I think that's one of the, I guess, challenges being Australia and being, such a small country, is that when you're trying to investigate something that's so rare but so important, it can take too long to get those results. And the interesting thing about the wheat trial is that both arms of the trial are already in practice. So it's not testing a new process, a new procedure, a new treatment. It's testing something that your baby is going to get one way or the other, whether it is withholding feeds or it is getting feeds during the transfusion. Like, it's something that's already happening. So it's so important. This trial's so important.
That is something that I really like about the trial, is that it's not anything experimental.
No.
So if you're born at one unit or another unit, or you're looked after by one neonatologist or another, because there's so much unknown about what we should be doing, you might be one baby getting one treatment, another baby getting another treatment, and it'd be nice to be in a position where we could say, no, we know this way is better, and everyone gets treated exactly the same way.
Do you think, from a parent's point of view, that makes it like an easier research project to be part of? That it's not experimental, it's not something new, it's basically standard care, but just trying to figure out which way is the best way.
I think so. And I think obviously all research that we do is really, really important, and it all gets heavily scrutinised by ethics committees. But I think this in particular, when you know that you're going to be treated in a standard way that most babies are treated with around Australia and around the world, and that your care is going to be no different, then I think that's much more acceptable to parents. And I think it's been really important with the design of this study that we've tried to make it really simple and acceptable to parents. That sort of takes us on to how we actually get consent for this particular study. Because there isn't an experimental arm, we talked to the ethics committee about whether it would be appropriate to do opt-out consent for this study. And what that means is that we approach all of our parents and give them written information all about the study, including showing them the video that we just showed before. They have all of that information, and we say to them, if you want to opt out from that study, then you're very welcome to at any time. But if you don't want to opt out, then at the time that your baby has the blood transfusion, they'll be randomised to one of the two care pathways. And for most parents, and as you know, Mel, you were sort of involved with us, sort of designing this. That takes a lot of the burden away from them thinking about that at a really, really difficult time. When their baby's going through this long journey, up and down journey, trying to, having to sign on the dotted line to say that you want to participate in a trial, and worrying about what that might do to your baby, it really does add that extra bit of burden that most families don't really need at that point. And to be able to say these are really commonly used care pathways, we'll just go down one or the other, but we'll do it in a randomized way so that we can work out which one's the best. And if that's something that you're happy with, then there's nothing else you need to do. And I think that's a lot more acceptable, I think, than our traditional trials. And that's the idea of doing the consent that way.
Yeah. And you just touched on, because a lot of the reason that Nat, Em and I wanted to do this network and use this platform was to actually be able to, showcase the partnership between parents and researchers and how it's changing care. So like you said, you saw on the end of that video that I do a little bit where I have a chat, and I'm actually a chief investigator, one of them on this trial. What has that meant, do you think, to the project to actually have parental input from the beginning in terms of the design of the trial?
I think it's critical, and I think it's so amazing to have you involved. But I think moving forward, I think that's got to be the standard for all neonatal trials, is to have parental involvement, because there's often a disconnect between what clinicians think is important and what families think is important and what's important to them. And, I think most of us should think that we should be answering the questions that are a priority for our parents and our families. and getting answers to those questions quickly and putting that sort of thing at the forefront. So, working out what the questions should be and also designing our trials. I think it's just so important to have our families involved in that process, to making sure that we're doing it as best as we can for our families, and also addressing the questions that are important for them.
Yeah. And especially when the consent process is a little bit different from what may have been traditionally seen is in trials. So for those that might be watching, a little bit what that looks like is that I get to have a real seat at the table. I participate in all of the trial committee meetings. I've also been really honoured to join the other investigators and actually present the trial to different NICUs. So I've travelled to Adelaide, to Melbourne recently. That's why I was in Darwin to chat about the week trial for the unit and for those families. So I think it's really important. And like I said, it's really something that Nat and I want to let other parents know, that they can actually use their baby's experience. They can use their journey, everything that you've gone through. And someone said to me earlier today, what does it feel like to constantly talk about your experience, especially, like the traumatic sides of it, but the fact that you can use that and give back and make that change, and look at, answering something as important as this. It might be rare, but for that one family where their baby gets NEC, it's absolutely devastating. It's absolute honour and privilege.
And it's so impactful. It's so interesting when we go and do these presentations to units. People's eyes glaze over when they're hearing about us sort of presenting our stuff, and then Mel comes on, but someone who has been through it all and is just able to say, hey, this is really important. It really gets people sitting up in their chair and paying attention. And so, it's a fantastic thing to do, and I hope more people do take it on, because
That's what we want.
That's what we want. Yeah, definitely. And I think, just thank you. I just want to quickly say thank you, Tim, for just you saying about how just the future of research and being able to kind of that kind of closer dialogue between parents and their questions or what they're interested in, and the design of research. Because for me, and I've said this again and again, and Mel, you would have heard it all the time, it's like there were so many points in the NICU experience where I was like, is it just me that feels like this? Has anyone ever had this issue? Is anyone doing anything about it? It was all those questions that went around and around in my head, and I think for me, I don't know, and this is why I'm involved, because it's just like, are these issues that I found relevant to me kind of being looked at? And I think they are, but there was the questions I think I was asking internally were probably very different to what the staff were possibly focusing on at the time. It's just two very different experiences, really. And sorry about kick.
No, you're right.
I'm just curious, for families whose babies are involved in the wheat trial, will they receive an update or information about the results of the trial afterwards, or is there somewhere they can go to find out about the results of wheat?
There definitely will be. It's probably a little bit early to have any specifics about where that information will be. But
we'll have you back on this show. We'll talk about it. Yeah, absolutely.
But it will be various platforms like that. But I guess firstly, any information from a large trial like this is going to get presented at very large international pediatric and neonatal conferences. And published in sort of high-ranking neonatal and pediatric journals. That's scientifically the main way that things are distributed, but also through various online platforms and other platforms. We'll be putting out the results of the trial so that it's freely available, and so that any families that have participated are able to see what the results are.
Nice.
Excellent. Is there anything else that you want to add before we finish up?
No, but I do want to say that I think what you guys are doing here is incredible, and just opening that dialogue, and I guess just having a bit more of an understanding of sort of what goes on with trials in general. I think is really helpful for parents and families that are going through this experience. So yeah, I hope you keep it up, and I think it's really valuable.
Yeah,
Thank you.
That's one of the things I think is so important. And I know when I went through it, like I was only having this discussion yesterday or the day before, where my boys were born at Liverpool Hospital, and when I walked in, the sign out the front had Liverpool Hospital, the university it's attached to, and then it said, this is a teaching environment. So when I was in labour with Elijah, I was in there for 32 hours. I actually had some students that were, in the room at the time. And it was no, I guess, surprise to me. I was in a teaching hospital, so I knew that was going to happen. It didn't say anything about research. And I know that that's changed, that the sign out the front now says it's a teaching and research environment. But I think that would have, I guess, awareness, or just, being open that you're walking into a facility where research happens. One, it's an expectation, but two, the more that we try and educate parents and, understand the importance, what types of trials are happening, we'd love to move where it becomes where parents will actually ask what trials are happening, can my baby join a trial, and things like that. So, yes, I think that's what's really important to us, to be able to have these discussions, be able to show which NICUs are currently recruiting. You might have a family member that's in there, your baby might be in hospital, so that when it does come, you go, oh, I've heard of that. I know the week trial, or you might see it on another cot, anything like that. But just being able to have that dialogue and have that openness, I think it's going to help change, the way trials happen, the way that they get recruited, that we can get them happening faster. And then on the other side, having parents like us continue to come on board to be part of the implementation and the design and all of that side, and have those discussions. It's just, it's a really exciting partnership. I think it's amazing. And I'm grateful that, there's researchers like you that are so open to having us on board.
Yeah, absolutely. I think it's as I said before, it's critical, and I think it'll become standard. Just awesome. So good to have you involved.
Yeah. Well, thank you so much for joining us. I definitely, when those results come out, we'll be having another chat about wheat.
Yeah. Oh yeah, I can't wait to hear. It'll be wonderful. Right, thank you so much.
All right, thanks, Nat. Thanks, Mel.
Yeah.
Bye.
That's a wrap on another episode of the NICU Live Network. Thanks for joining us today. To stay connected, please make sure you're following us on social media and have joined our Facebook group.
And if you found value in this episode, please share, like, or comment.
We'll see you on the next episode.